Lawmakers grilled the Health and Human Services Secretary on Thursday over vaccine policy as several states make moves to ensure vaccines remain widely available. Danny Spiewak joins us with more on how Minnesota lawmakers are responding. Danny?
Julie, this afternoon I spoke with DFL State Senator Matt Klein, a physician who says he plans to introduce legislation next year to protect vaccine access. That includes an idea to establish a commission in Minnesota that could set its own vaccine recommendations.
I never promised that I was going to recommend products with which there is no indication.
In a tense hearing, Health and Human Services Secretary Robert F. Kennedy Jr. answered questions this week about the recent decision by the FDA to limit COVID vaccine approval to people 65 and older or those with underlying health conditions. The change means it may be harder for everyone else to either get the shot or have it covered by insurance.
When were you lying, sir? When you told this committee that you were not anti-vax, or when you told Americans that there's no safe and effective vaccine?
Both things are true.
Oh, so more denial.
In response, 4 Democratic-led states have formed the West Coast Health Alliance to offer their own vaccine guidance to residents. DFL State Senator Matt Klein now proposes doing the same thing in Minnesota.
We need to stand up for the truth and we need to lean into it.
Next session, Klein plans to introduce legislation to establish a Minnesota Healthcare Commission that could make its own vaccine recommendations. His proposal will also include requiring insurers to cover vaccines and mandating that pharmacies carry them.
That's a great way to get vaccines out, and that patients, when they go to get their vaccines, are not confronted with a new high copay.
Meanwhile, CVS says the COVID vaccine remains available in Minnesota locations, and at Walgreens, people who aren't older than 65 or have an underlying condition can get the shots with a prescription. United Health and Blue Cross Blue Shield also told us they'll continue covering COVID shots. But any legislation to enshrine vaccine protections into state law would require Republican support in the divided legislature.
I can't wait to have those conversations. I would really think so. There are healthcare providers, nurses, and physicians on both sides of the aisle.
Leaders in the Minnesota House GOP and Senate GOP have not yet weighed in on Klein's proposal. Last session, a handful of Republican lawmakers introduced an opposite proposal to ban mRNA vaccines, such as those for COVID. Also, a spokesperson for Governor Walz said today that the governor is reviewing actions that Minnesota can take to fight back against the Trump administration's vaccine policies. Back to you.
All right. Thank you, Danny.